Hello, my name is Marissa Morales, and I did my research on the Rocky Mountain spotted fever. First, we'll be talking about some background and distinguishing characteristics. According to the American Lyme Disease Foundation, tick species that transmit RMSF are Rocky Mountain wood tick, American dog tick, brown dog tick, and their scientific names are Dermacentor andersoni, Dermacentor variabilis, and Rhynchocephalus sanguineus. The American Lyme Disease Foundation also mentioned that since dogs are susceptible to the Rocky Mountain spotted fever, the canine tick, whose scientific name is Amblyomma genuinus, has been shown to act as a vector. Here is a simple demonstration that shows the difference in larva, nymph, and adult stages, female and male. Here's another photo that shows the wood tick and shows its characteristics from brown, beige, and darker brown, and its length in a few millimeters. The reason I put spring to summer is because more cases were then reported during this time, and I believe that is because more people are more inclined to going out during the spring and summertime, such as camps and other places outdoors. Here is a picture of Howard Taylor rickets. According to author Walker, Howard Taylor rickets was first to identify the infectious organism. However, this research advanced with the help of R. Parker and Willie Bergdorf at the Rocky Mountain Laboratories in Montana. In 1896, according to the National Institute of Allergy and Infectious Disease, this tick-borne disease was the first to be recognized in the Snake River Valley of Idaho and was called the black measles. The reason for this being was because it showed up as a rash and then turned the skin black. However, it was mentioned by the NIH that in the early 1900s, this disease could be found in Washington, Montana, California, Arizona, and New Mexico. Human health. Here's a map that shows cases per million around the world. According to the CDC, RMSF is an emerging public health concern, and it has resulted in thousands of cases and hundreds of deaths in the past decade. Symptoms that occur are fever, muscle pain, headache, vomiting, nausea, loss of appetite. However, patients do not always feel the same thing, such as this rash. Not every patient shows up with a rash. It was also mentioned by author Masters that there is lethal damage done to the endothelium in the dermis, lungs, heart, kidney, gastrointestinal tract, brain, skeletal muscle, and other sites, which can then lead to more devastating manifestations such as cerebral edema, acute respiratory distress syndrome, and other complications that are irreversible. Here's a few pictures that show the rash and an edema happening to the phalanges. Treatment. Here's a list of the antibiotics that are given: doxycycline and chloramphenicol. If treatment is not started almost immediately, it will result in death. Since symptoms are so closely related with other illnesses, this is why people often get illnesses mixed up and thus leave these untreated. Doxycycline is given to adult and children. However, since this medication is not recommended for pregnant women, chloramphenicol is then given to them. But author Masters stated that chloramphenicol is associated with a higher percentage of fatal outcomes. Another reason for a higher percentage of fatal outcomes overall is the reason why people do not immediately start antibiotics quickly or start taking care of themselves. In conclusion, vaccines. There are still no vaccines for the Rocky Mountain spotted fever, and it is because this is spread through the bacterium rickettsii. However, to slow the spread, expert Rev Anti-Infection stated that Rocky Mountain spotted fever can be prevented by a numerous amount of ways, such as wearing long sleeve, light colored clothing, checking and removing tick attachments, as well as applying topical insect repellent and treating clothing with Premarin. However, do not forget to take care of our furry friends. There are countless amount of ways to prevent ticks from invading your pet's skin, such as keeping them nice and groomed, spayed or neutered, tick collar sprays such as Top Spot, shampoos, or oral medication. I believe that all of these can lead into a lower amount of death rates all around the world. It just depends on how you prevent it, such as refusing to go outside during the spring or summertime. Another thing that people do not take into consideration is growing or building your home in the wilderness. For example, a lot of people are more inclined to build their home because they are more with nature. However, this is not a good idea because of the deers and other animals that may harbor these ticks. Therefore, so becoming educated on this very rare tick-borne infection will allow for the spread to slow down, and thus death rates will drop opposed to increase by thousands. Here is my works cited. Thank you.